guys, welcome back to my channel, which is Real Homeopathy. Please do like, share and subscribe to my channel. As in Instagram, I have asked for psychology and gynecology videos and you all have voted more for psychology and I thought of doing it today. So I'll be explaining on psychology. So today I'll be explaining lectures on psychology, which is very essential for you all to know. We'll begin with the definition of this psychology. So what is the definition of psychology? The scientific study of human mind. Scientific study of human mind and its functions. To study on human mind and to know the scientific functions of this scientific study of human mind and its functions. To know that, we call it as psychology here. And for a change, the mental characteristics or attitude of a person. To study the mental characteristics of a person. To study mental characteristics of a person or attitude of a person, so we call this as psychology. So we'll see the major branches of psychology. The major branches of psychology you see here is abnormal psychology, second one is behavioral psychology. Third one is clinical psychology. Fourth one is cognitive psychology. Fifth one is counseling psychology. Sixth one is developmental psychology. Seventh one, educational psychology. And experimental psychology, forensic psychology, health psychology, etc. So these are the psychology types. So these are the branches of psychology, and this was just an introduction to my psychology class. And today I'll be explaining the main part of homeopathic mental history and analysis of that mental history. Firstly, what I have given in the previous was the definition of the psychology. Some of you all should know, before understanding the psychological lectures, you have to understand the definition of that and its branches you have to understand. So, hints on taking the mental history and analyzing it. So I have made certain notes on that for you all to be very easy to understand it. So every homeopath has his or her own style. When it comes to case taking, a person or a homeopath, each and every homeopath differs in their case taking. Everyone is not same. Everyone has their different and their own way of case taking. So firstly, we have to avoid the common mistakes which are being done by every student homeopath in taking and analyzing the mental history. So mistakes which often lead to wrong remedy which they have prescribed. I will also describe you some techniques which I have found useful in my practice. So let us begin by examining what information can be gathered from the first impression of the patient. First impression. So as they walk in, first one is as they walk in and sit down. That means a person's gait has to be observed. How he walk, Okay, how he sit down, that all behavior of the patient has to be understood by a physician or a homeopath. As always, first impressions can be misleading from the first few moments of the interview, which can then be analyzed in the context of the subsequent history. Obviously, the appearance of the patient can say a great deal. The patient can explain by his walking movement even without saying anything. So, as we say in organon, the subjective and objective symptoms. Okay, subjective is what you. So, there are subjective and objective symptoms which we observe. Some symptoms are said by the patient or his attenders, or the patient himself feel that. Objective symptoms, which means that the physician will observe. When the patient don't say, the physician will observe that symptom. So, a thin, delicate woman with black hair. Okay, a thin, delicate woman with black hair. Woman with black hair. So, it might not likely need a calcarea carb. So, it might not likely need this calcarea carb remedy. Although the homeopath must be flexible enough to realize that exceptions always exist. Okay, the degree of caution or enthusiasm with which the patient greets you should be noted. So you should examine how the patient behaviors, how he is with enthusiastic, or the degree of caution which you call the degree of caution. The degree of caution. There are certain remedies for this, or how the patient greets whenever he is coming inside the clinic. So this thing you have to observe, which is the physical behavior or appearance of the patient, or something you say, or as a fear of reserving kind of personality, fear of reserving. You see, there is arsenic album, baraita carb, China, the Kalis, okay, the natrums, Kalis, natrums, Nux group, Cilicia, and Thuja. Finally, these are degree of caution here. Remedies which come under the degree of caution, which is also called as enthusiastic. How the patient enters and greets when he comes inside the clinic. So, Nux is not usually reserved. So, this Nux is always not usually reserved here. Not usually reserved. Rather, he is often suspicious. Rather, he is often suspicious. Okay. Rather, he is often suspicious of unorthodox practices such as homeopathy. He is very suspicious kind of personality. So, next we will understand something here. The types likely to greet homeopath with enthusiasm even on the first consultation. There are other remedies other than these who greets enthusiastically. We see there is argent nitricum, causticum, ignitia, lachesis, madorinum, mercurius, phosphorus, sulfur, and in bracket I should write natrum here. The more extrovert natrums can put the homeopath on the wrong track with their enthusiasm, which may hide misgivings about putting themselves in a vulnerable positions. What does this sentence mean is extroverts natrums, they can put the homeopath into a wrong track, being more enthusiastic and making the physician more in a confusing track. He becomes more enthusiastic. So that means the natramure patient is actually enthusiastic and he behaves like he is. those patients who come in visibly irritable. So this was before, it was all about enthusiasm here. Enthusiasm, enthusiasm, enthusiastic patients there. Here, irritable. Whenever a patient enters the clinic, he becomes already irritable there. So, because he was waiting in a waiting corridor for 10 minutes, and he became irritable by waiting in the queue for a patients. So they are likely to be arsenicum patient, natromure again, natromure, mercurius, or nux. So these are here. Observe the position that the patient adopts on sitting chair. Second observation you have to do is observe how the patient sits on chair. How he may sit. Okay, a patient who sits as far back as they can, or who chooses a chair more distant than the one meant for them, is likely to be one of the cautious type, which I have listed here, which is a cautious type here. As I have mentioned here, cautious type, arsenical, Baraita, China, carries Metromure, Silnax, Silicia, and Tuja. So this is a degree of cautions. So how the patient sit here is, he sits on the chair, he takes the chair very far back as they can, and they chooses with the physician and the patient to be in a more distant way, a little far. So this is a cautious type. Similarly, someone who leans forward in the chair, leans backward, leans backward, the remedies which are same for caution, the degree of caution I have explained behind back. And uh, who likely to be cautious one, who leans forward again, leans backward ho gaya, leans forward. The patient, when he sits on the chair, he leans forward. So what happens when he leans forward? Probably it belongs to enthusiastic type. Okay, especially the phosphorus, he comes under this category, phosphorus. Next observation you have to do is the clothes of the patient. The clothes, how does he behave for when he sit on the chair. So clothes that the patient is wearing, it may provide relevant information. Okay, a flamboyantly dressed patient is likely to lead a flamboyantly, the patient here need or likely he has dressed is argent nitricum, okay, medorinum, phosphorus, or sulfur. Okay, flamboyantly. Firstly, how the patient dresses. So how the patient dresses here is flamboyantly, very a kind of dressing sense he have. So flamboyantly, certain drugs comes here is argentum nitricum, medorinum, phosphorus, and or silicia. Flamboyant is a person or it is a behavior tending to attract attention because of their confidence and stylish. So person is more confident here. He just wants to explain like I'm very confident. He just dresses very stylishly. So it comes in this argent, medorinum, phosphorus, and or sulfur. Certain types are more likely to wear black. Okay, certain people tend to wear black here. Particularly Ignatia, Natromure, and sepia. So these are the three remedies. Next coming to the emotional types. Emotional types, you see phosphorus, pulsatilla, and graphitis. Okay, they often wear pink. Okay, they often wear pink, and these often wear black. These flamboyant are stylish, and confident. Okay, stylish and confident. At least the females here. They are very emotional. Solvently dirty, untidy. Okay, dirty, untidy dress. Sense favors in cases of Baraita, Mercurius, and Sulfur. So the woman who wears a rather mainly suit is probably Ignitia, Natrum, or Sulfur. So I think this is all about the clothes they wear. Okay. Next we come for okay. Further we come for by the time one reaches the mental history. First we have to understand what is the mental history. One should already have some feeling of the personality of the patient. He is walking, his guide. Firstly, we should observe how the patient sits, how he enters. We have to observe how the patient is, okay, and degree of caution, how much he is enthusiastic. Okay, first that one, and next one is observe how patient sits on chair, whether he leans forwards or he runs far from the physician, or when he leans forward, that one. And thirdly we have come for a clothes here. There are clothes pay. We have seen flamboyantly, who is very stylish and confident. We have seen black, and we have seen pink, who are emotional, and finally we have seen the fourth one, which is dirty or untidy dress. So by the time this all we see, we have to understand certain confident how the patient is. So when taking the mental history, I recommend you at least asking the patient and to talk about themselves first. Before asking them specific questions, we should ask them, we have to say about yourself. So a patient will explain that one. Okay, if the patient's first remarks are a denial of a negative trait which has not been brought up by other homeopath, one should suspect the opposite of what the patient says. When about relationships in general, one rather proud like SS man said, I'm not a jealous type, telling me immediately that jealousy was an issue for him. Certain things you have to personally hold. Like his patient is very jealous, and when he says that, the person is obviously jealous. So he just explained what he felt. Once the patient has exhausted his or her self description, it is time for us to question them. First, we have to allow the patient to speak. If the patient's main concern is lack of self confidence, if the patient's main is lack of self confidence, there are certain drugs here. Lack of self confidence. In lack of self confidence, you will get alumina, argentum, baraita, china, graphitis. Okay, graphitis, lycopodium, pulsatilla, silicea, etc. And even natrums. So ask the patient in which situations they feel this lack of confidence. If they say they feel lack of confidence in group of people, they say I have that lack of confidence. What you have to think is natrums are likely to have that kind of fear or lack of confidence when they are in group. When they are in group, they have this kind of lack of confidence. Natrum is the best remedy you can give. If the patient says all the time I feel lack of confidence all the time, think of baraita, okay, lycopodium, argentum, and alumina. If they say all the time I fear, then that is what. If worrying is the patient's main symptom, if worrying is his main complaint, about what they worry, about everything, then think of alumina, okay, calcarea, then lycopodium, calis, natrum, carb, phosphorus, and sepia. The patient whose worries center around work, so worry about everything, worry about work here, Worry about work is especially likely to be lycopodium. Worries about health. Worries about health that are not realistic are found in hypochondriacal types, such as hypochondriacal types. It comes in like arsenicum, calcarea, calis, phosphorus, natrium. Okay, so this is a hypochondriacal one. If a patient has a fear of finance, financial worries, we unrealistically think of arsenicum. Should think of this arsenicum. I always ask the patient's fears and phobias. So this is when you take a mental history. You have to ask for what? You have to ask for the phobias here. What does a patient feel? So phobias like fears. What does he fear? Okay. Firstly, we will see report of fear that their lives will amount to nothing. Natromure is such a great remedy for that. Some may say they do not feel in control, such as flying in an aeroplane or a blind date. This all. Okay. Claustrophobia is most commonly seen in natrums, but also in argent nitricum and stramonium for claustrophobia. Lachesis is a kind of claustrophobia which occurs when the air supply is poor or when the nostrils and mouth are primarily obstructed, such as in opening theatre when put in a mask, okay, kind of thing. Medorinum often has a fear of going insane, as does stramonium also. Paranoid fears, such as subtle but are very useful when spotted. An example is a really tendency by the patient to assume that people are talking about them or laughing at them on frequent occasions. This is a paranoid symptom. So, fear of seeing a policeman. Fear of seeing a policeman. Fear of seeing a policeman that they will be arrested. So, fear of seeing a policeman. Paranoid fears such as like anacard, argent nitricum, arsenicum, china, hyoscyamus, lachesis, mercurius, natrum, stramonium, veratum, and thuja. So these are the remedies which comes for paranoid fears as of being arrested by a police. So most people are afraid of snakes. Afraid of snakes here. Afraid of snakes, but if the sight of a snake on a television makes a patient's heart pound. Television. Okay. This suggests that patient is most probably needing lachesis or natrum mure. Fear of dark. Fear of dark is commonly baryta, graphitis, medorinum, phosphorus, pulsatilla. Okay, fear of dark. Fear of death is most common in arsenicum. Manifest reluctant to even think about the subject or even intruding fearful thoughts. It's also common amongst natrums. An excessive fear of catching a contagious disease. Fear of catching contagious disease. I have got one patient, contagious disease. She was of a age of a 45 to 50 years. She was of, I think she was 48 years old, and she said me, she's a female, and she said me that she's having a fear of having a contagious disease. She thinks that no, I will die from some dangerous disease, I will die. And she used to call me and she used to say me, can you please just bring me out of this? I am fearing for more than a year since I am a childhood. I feels like I will get cancer and die. I will get some contagious disease and die, like AIDS or something like that. The patient used to frequently say me, and when I studied the case, I I got the arsenicum remedy for that, which has worked wonderful for her, and I have given 10 m arsenicum, one dose of that, and still now she is not having any kind of fear. Okay, so this is how the arsenicum worked for her when it comes to catching of a contagious disease. So here the first remedy is arsenicum, calcarea, and syphilinum. Okay, contagious diseases. Fear that a loved one will die. Loved one will die is common in ignitia. Common in ignitia and natremure. And these remedies are also having fear of abandonment, feeling of being left alone. Feeling of being left alone. Abandoned. I even got one psychological case where I see their children are going to their other places, and here the mother is suffering that she will be left alone. I gave her natramure as it was matching her constitution, as it was matching her mental symptoms. I gave her natramure 10 m, and she is feeling better now. Because when you have to see the person's behavior, she just cries, rolls on the floor and cries, please don't ask them to go, because these are the psychological diseases that you have to see, you have to check on that. Okay, so fear of the loved ones will go far away, will die. So this all will come in ignitia, fear of loved ones, losing them, being of abandonment. Abandonment means being left alone. This is a strong fear of that. Strong fear of abandonment. Abandonment means fear of being left alone. Some patients admit to experiencing very little or no fear in their lives. Okay, patients often complain of difficulty in relating to other people. They are lack of confidence or shy. I have also said you it comes in natrums, alumina, arsenic, arum, ignitia, calis, lycopodium. And next coming to guilt feelings. Some people feel guilty of what they have did, and full life मैंने उसको ये नहीं करना था, वो मर गया इसके वजह से, शायद मैं ये कर सकती थी उसके लिए, वो बच सकती थी, मैं नहीं कर पाई. So this is how the patient will full life psychologically, the patient will go in a guilt feeling. So in that time you can think of natrum muraticum and lacasis and tuja. The patient who feels responsible for everyone else is more often than not natramure. Very essential remedy here is natramure. I hope you all have liked my today's class, and I think it was helpful for you all. And I think this medicines all I have explained is all related to psychological patients, psychosomatic diseases. Okay, you have to analyze the case, you have to even take the symptoms, what are the fears of that patient, how does he even think, what are his, how is his angry, whether the patient is very much irritable or what, he is very talkative or what, how is his behavior. Okay, you have to know all of these things first, then only you will understand all of these things. Okay, you have to observe this dressing sense, you have to observe how he sits, how he talks, how he moves around. Okay, what are the fears or phobias of a patient, paranoid fears, fear of snakes, fear of dreams, fear of dreams. I will say in again a separate class. Dreams, what dreams implies to what. Okay, I'll be saying it in the other class. This is all of the paranoid fears, paranoid fear, all of that, fears, phobias. So this is it for today. And guilt feeling. very essential. Fear of being, I've recently seen 2 cases. Oh my god, it is very horrible. You have to go and just try these remedies. One on catching a fear, I have given arsenicum, and one is being left alone, feeling of being left alone, natriumur. So psychologically you have to give, this is, the class has finished and this is just for information, what potencies you have to give when it comes to mentals. When it is a mental case, always don't give 30, always don't give 200. Just begin a case with higher potencies like 1m, okay, 10m. You have to always begin a case with these things. Suddenly the mental के लिए, if you're going to treat a mental cases, just don't even begin with 200. 200, why they give 200? 30 is for mentally, if the patient is suffering, sorry, okay, 30 is for physical symptoms. The patient is physical symptoms, any of the physical symptoms without affecting any mental thing. 200, why they give both mentals and physicals, okay. And why they give 1m or more is for mentals. Any mentals diseases are there, then you have to think of this higher dose, 1m, lm potency, cm potency, okay, millisimal potency, senvisible, okay, large millisimal potency. These potencies you have to give for mentals, okay. And I would ask all of you to like, share and subscribe to my channel. Stay tuned for more updates.